It's a real honor to be with you today and share some Bible passages and reflections on our calling as healthcare professionals to share God's love as instruments of His healing, and the story of my own calling and journey as a physician. This passage reminds us that our first calling is to become God's children. I was blessed to be born the oldest child into a devout Christian home. My father, a Baptist pastor in rural Texas. I've been attending church since I was 2 weeks old. And I distinctly remember one Sunday morning when I was around 5, listening carefully for a change to my father's sermon. And I distinctly remember hearing God's call for me to become His child, understanding that Jesus had died for my sins, and yet I consciously put off the decision to accept Him as my Savior. My parents felt the call to international missions and were appointed as missionaries to Uruguay when I was halfway through first grade. Our family moved to Costa Rica to learn Spanish. And 2 weeks after we arrived, I pulled away from my mother to run across the street of a busy intersection to be hit by a Volkswagen Beetle. Seriously injured with broken ribs, a lacerated liver, intra-abdominal bleeding, and hemorrhagic shock, a gifted surgeon of Clinica Biblica, the Bible hospital, was God's instrument for providing life-saving surgery and physical healing to my life. Shortly after I was released from the hospital during a Sunday evening children's Bible study led by another missionary, I again felt God calling me to be His child. Realizing that He had saved my life physically and given me another chance, I answered His call and asked Him to save me from my sins, and He has been present in my life ever since. We talk about our professions as a vocation, a calling. Many of us have felt the divine calling to our individual health professions. My experience as a trauma patient hospitalized for 3 weeks in Clinica Bautista gave me a fascination with medicine. And I began to feel a real sense of calling somewhere around the age of 7 or 8 to become a physician. And that calling has persisted to this day. Do you remember the time when you first felt God calling you to become an instrument of His healing? Dr. Luke tells us that Jesus called His disciples together and empowered them to drive out demons and cure disease, and then sent them out to share the good news and be instruments of His healing. They had no power to heal people on their own, but He empowered them to be healers. Why did Jesus link proclaiming the gospel with healing the sick? Because the spiritual needs and physical needs, sins and illness, are intimately related. Jesus knew that true healing involves healing of the mind, body, and spirit. Early in my medical training, I began to understand the important linkage between spiritual and physical healing. And I began to view practicing medicine as a way to minister to the spiritual and physical needs of my patients, a way to share the good news of God's love as an instrument of His healing. In his first letter to Corinthian church, Paul notes that God has placed different kinds of gifts in His church. And some of us, He has entrusted gifts of healing. He has called us and gifted us to be His healing instruments. Have you ever thought about all the gifts that God has given you that enable you to be an effective healer? As I look back on my life, I am amazed at the gifts that God has given to me. He gave me the gift of growing up in Uruguay in a missionary family, completing most of my primary and secondary education in Spanish and becoming bilingual and bicultural. This has enabled me to provide care to Hispanic patients in their own language and cultural context across my career in this country and across Latin America. He gifted me with intellectual curiosity, a love of science, an analytical mind, a passion for understanding people, and compassion for their hurting, motivating me to provide comprehensive whole person care to my patients. He led me to become a family physician and to the wonderful opportunity to contribute to the development of my specialty across Latin America and around the world. He gave me a love for teaching and the opportunity to teach healthcare professionals in many countries throughout my career. He gifted me with the ability and passion for leadership and the opportunity to lead medical school departments, large physician groups, hospital medical staffs, and to develop a new medical school at the University of Houston focused on training primary care physicians who will provide care to underserved communities with major health disparities. And in each of these situations, God has given me opportunities to share his love and be an instrument of his healing. Sometimes God calls us to leave our comfort zone, to go and share the good news with those who have never heard of him. Caring for the medical needs of hurting people is a powerful way of sharing the gospel of Jesus almost anywhere in the world. Now, despite my missionary heritage, my own interest in international medical missions did not develop until I'd completed my medical training and entered rural medical practice. My wife and I participated in our first medical mission trip to the Caribbean island of Antigua in the summer of 1981, spending a wonderful week providing care to people who had great medical needs. I felt at home working in the developing world, and I knew that going forward, I wanted to spend more time serving God in that setting. A year later, I felt called to full-time medical education and left my practice to join the faculty of the University of Oklahoma College of Medicine. In the summer of 1984, I had the opportunity to attend one of the first meetings on family medicine in Latin America, in Panama, and met some of the early leaders in the specialty from that region. Because I had a medical school faculty appointment in the United States and was bilingual and bicultural, I soon began to receive invitations to speak at conferences, teach in medical schools and residency programs, and consult with ministries of health and healthcare systems all across Latin America. One of the first places I was invited to teach was a new residency program at a small hospital that had been started by a Christian physician in Neuquén, Argentina, for the purpose of sharing the good news through medical ministry and training Christian family physicians. I visited the program yearly over the next 3 years, and I began to wonder if God was calling me to move to Argentina to help grow the hospital and teaching program. I felt very much at home in my adoptive culture and language. Maybe God wanted me to serve him there full time, but a clear call and opportunity to work full time in Latin America never came. Working in academic medicine in the United States allowed me to spend 3 to 4 weeks a year abroad, teaching local medical students, residents, and faculty physicians in various countries, and teaching U.S. medical students and residents on medical missions in developing world settings. We also established an international faculty development fellowship for Spanish-speaking physicians to learn teaching skills in our departments in the U.S., training over 150 faculty over 30 years who returned to their home countries as teachers. I came to realize that although God hadn't called me to live and work abroad full-time as a medical missionary, He had given me the opportunity to teach physicians all over the world and to role model sharing God's love as an instrument of His healing. In 2007, my pastor asked me if I thought our church, West University Baptist, would develop a clinic to serve Hispanic patients in the Houston area who had no health insurance or access to care. Years before, I had volunteered at a similar clinic in Oklahoma City. So we traveled there to learn more about faith-based clinics. And our church decided to start Casa El Buen Samaritano in partnership with Iglesia Oreb, a Hispanic congregation in Southwest Houston. For 13 years now, this clinic has shared the good news of Jesus through volunteer healthcare providers from several area churches who minister to the physical, emotional, and spiritual needs of our patients as instruments of God's healing. In 2012, after 30 years in full-time academic medicine working in the United States, my wife and I felt God calling us to live and work in the Middle East, to be salt and light in the Muslim world. I had the opportunity to work for Johns Hopkins Medicine International in the United Arab Emirates as chief medical officer of Tawam Hospital, a 460-bed teaching hospital in the city of Al Ain, affiliated with the UAE University School of Medicine. My prayer in going was that I would learn to love the people there as much as I do Latin Americans. 2 weeks after we arrived, I told my wife that the UAE was beginning to feel like home. We spent 30 wonderful months there overseeing the work of 530 physicians and 9 residency training programs. I made round with different resident teams every day with opportunities to teach and role model compassionate patient care. There were many opportunities to share our faith, and every day we found joy in our relationships with the people of that place. And then we felt God calling us back to the United States without even knowing what we were to do when we returned. Shortly after we arrived, I was invited to assume the position of planning dean for a new medical school at the University of Houston. It took 5 years to develop, and on July 20th of last year, we enrolled our inaugural class of 30 students. Over the years, God has called me to serve Him in many places and given me many opportunities to share His love as an instrument of His healing. When Jesus, the great physician, was here on earth, He was our role model of compassionate healing. You know, there's growing scientific evidence today of the power of compassion in the healing process. When members of healing professions develop compassionate relationships with their patients, care outcomes are better, costs of care are lower, patient satisfaction with their care is higher, and the healing professionals experience more joy in their work and less burnout. Dr. Luke's story about the healing of the leper is my favorite from Jesus' healing ministry. The man was physically sick, he was socially isolated, and he was likely emotionally depressed and spiritually impoverished. He desperately needed and wanted to be healed, and he had faith that Jesus could heal him. In that day and time, he was considered to be infectious and unclean. He was an untouchable. Who are the untouchables in our world today? Dr. Luke tells us that Jesus reached out his hand and touched the man. Why did Jesus touch an untouchable? I believe he touched the leper to connect and establish a relationship with him, to show him compassion, to heal him. His leprosy left him, his social isolation resolved, he was no longer depressed, and he developed a personal relationship with Jesus. When I lived and worked in the Middle East, I realized how much I use touch in relating to patients, because in that culture, a male physician cannot physically touch a female patient except under special circumstances. A little over a year ago, while seeing patients at Casa Buen Samaritano, I entered the examining room to find a 40-year-old woman who was in great distress. I asked her about her problems. She told me that her husband had left her. She was unemployed. Her teenage children were acting out. She felt lonely. She felt depressed. She felt stress. And she had great physical discomfort. I asked her if she was a person of faith, and she said, "Yes, I am a believer, but right now God feels so far away." I reminded her that God cared about her and wanted her to have an abundant life. I reached out and touched her, and we prayed together, and I asked God to reach out and heal her, to bring healing to her body and to her mind and to her spirit. I asked her to come back and see me in a few weeks, and when I saw her again, she was a new person. She said that all of her anxiety and depression and stress had left. She felt physically well, and she had renewed her relationship with the Lord. Jesus understood that one of the most important roles of a healer is to bring hope to patients and their families. During these difficult times of the COVID pandemic, our patients desperately need hope, and they can find hope in the good news of Jesus. In John 10, verses 9 through 11, Jesus said, "I am the gate. Whoever enters through me will be saved. They will come in and go out and find pasture. The thief comes only to steal and kill and destroy. I have come that they might have life and have it to the full. I am the good shepherd. The good shepherd lays down his life for the sheep." I share these verses often with patients who are in need of hope. Jesus, the good shepherd, who laid down his life for us, came that we might have life in abundance. That doesn't mean that we will be wealthy or even healthy or that we won't ever suffer, but he gives us the hope of a full and blessed life, and we can share that hope with our patients. One afternoon when I was working in the United Arab Emirates making rounds with our surgical team, we came to the room of a Filipina woman who had been severely ill in the intensive care unit, had to receive life-sustaining infusions of blood pressure agonists to keep her alive. In the process, she had developed gangrene in both of her hands and both of her feet. She was in the hospital waiting for the gangrene to delineate so that the surgeons would know where to amputate each of her 4 limbs. Needless to say, she was terribly depressed and distressed. She looked at the wall, wouldn't talk with us. She wasn't eating. She was in a bad place in her life. We stepped into the hall, and I asked the residents if anyone had talked to her about her spiritual life, if anyone had asked her if she would like to see a chaplain. Now, that hospital didn't have chaplains for the Muslim patients, let alone Christian patients, but I thought that the fact that she was from the Philippines might mean that she had a Christian heritage. When the residents left, I told the chair of surgery, who was an American Mormon believer, that one of us needed to talk to her about spiritual things. And he said, go ahead. So I went back into her room. I stepped up to her bed. I put my hand on her arm above her gangrene. I asked her to turn and look to me. And I told her that I could only imagine the pain and the distress that she was going through. I asked her if she was a person of faith, and she said, yes. In my country, I attended the Catholic Church. I reminded her that God cared about her, that God was present in that room, and that he would help her to get through this terrible crisis. I asked her if she would like to see a chaplain, perhaps the priest of the local church, to pray with her, and she said that she would. We arranged for the priest to come and for some prayer warriors from our evangelical church to come. And over the next week, they covered her in prayer and ministered to her spiritual needs. A week later, when I came back, she was a different person. She still had the gangrene, still faced the amputations, but had hope in Jesus, hope for abundant life despite the difficulties that she faced. Our most important hope as God's children is that Jesus is preparing a place for us. He will return for us, and we will live with him through eternity. Toward the end of my stay in the United Arab Emirates, my mother back home had a massive stroke, and we felt that she was close to going to heaven. I had seen her a month or two before, decided not to travel until she would die and we would have her memorial service. But I talked to my deputy medical director, Dr. Sheikha, who is a devout Muslim believer, about the fact that I would need to come back to the States in the case that she died. She said, Steve, why don't you go back now, see her before she dies? And I said, Dr. Sheikha, I saw her a couple of months ago, and I will see her in heaven. And she said, Steve, how do you know that? We believe that Allah makes that final judgment on Judgment Day. And I said, Dr. Sheikha, we know that if we have a relationship with Jesus, he will take us home with him. May God use us to share his love with the hurting people that surround us as instruments of his healing and hope. Thank you.
Or whoever's talking to you, Chuck.
Dr. Stephen Spann, always encouraging to hear from you. Great presentation, and we're excited to welcome him here in person. I want to mention, though, our Q&A section is open. You'll see it right there, just the Q&A tab. If you have a specific question for Dr. Spann, go ahead and click that tab, put it in there, and we'll do our best to get those. But Dr. Spann, welcome. It is so good to have you here.
It is great to be here.
Loved your talk, Dr. Spann. That was just wonderful. We're instruments of God's love and healing. I love that. You know, I was going to ask you, we've had several people that have inquired about this during the conference, but you talked about providing compassionate care. But in providing compassionate care, sometimes, Dr. Spann, you know that you can use up all your compassion, so to speak. Not really, but you can become fatigued. You can have compassion fatigue, and so prevalent now, burnout, and even sometimes depression amongst caregivers. It's a big subject. It's a long subject. But would you have any encouragement for people that may be watching right now that are right on the edge of that and just say, you know what, I don't know if I have much more to give?
Absolutely. And, you know, I think the COVID pandemic and the stress, the difficulties, the sadness of dealing with people who are so sick and dying has just compounded the compassion fatigue and the burnout. Pre-COVID,
Right.
we know that 50% of our physicians in this country were burned out. And I think it's probably worse today.
Yeah.
And it's easy, isn't it? It's easy to give and give and give, and at some point just burn out. A lot of factors go into burnout. The hamster treadmill that we get on in practice, electronic medical records have not been the easiest thing to deal with. But I believe that one of the fundamental causes of physician burnout in our culture and society is the loss of joy. I think that we have lost the joy of caring for our patients. And I think joy comes out of compassionate relationships. There's a book that was published a couple of years ago by a couple of professors in New Jersey. And the title of the book is Compassionomics. Where you hear about genomics and proteomics. This is about compassionomics. It's an evidence-based review of the literature about the impact of compassionate relationships on our patients, the outcomes of care. And what they show very clearly, very evidence-based, is that when our relationships with our patients are compassionate, they have better outcomes, the care costs less, of course the patients are way more satisfied, and the providers of care, the healthcare professionals, have more joy and less burnout. I think we need to recapture the joy in medical practice, and that will help us deal with compassion fatigue.
So the remedy to compassion fatigue may be having more compassion in
It really
relationships.
is. That's how we can recapture the joy.
One of the exciting things that's happened here in Houston in the last couple of years has been the new College of Medicine at the University of Houston. I've heard you give some talks before on the vision of the College of Medicine, and it's quite different than most medical schools. Tell us just a little bit about that.
Well, one of the fun things about getting to plan this from the get-go was that I could apply all of my learnings from my long and varied career and my beliefs and my passions to develop a different kind of medical school. And we really wanted to develop a medical school, a place to train young physicians that would really focus on improving health and health care, on training compassionate physicians to provide what we call high-value care, meaning great quality of care for reasonable costs, and to have a focus on communities in our city that have major health disparities. To teach these physicians to be about social determinants of health and caring for the needy and the underserved. And so that's really the focus of our new College of Medicine. And the exciting thing is that our first class that was enrolled in July of last year is absolutely mission consonant with that. They are passionate about that mission. And we're already seeing them getting involved in the community, in the lives of patients that have significant needs.
We think we have to go to Africa to serve the poor or the underserved, but they're right here amongst us, aren't they?
Absolutely right. There are numerous geographic communities within the greater Houston area that have health indices that are similar to the developing world. We have major health disparities between the, quote, healthiest zip code and the unhealthiest in our city. 19.3 years of difference in life expectancy. That is huge. There are people here that are suffering due to lack of access to health care. Almost 30% of our population now, adult population, has no access to care, no health care insurance. We have significant food insecurity, major needs in the healthcare, in the health and healthcare arena.
It's obvious from your talk and just knowing you for several years now that you have a passion for Latin America and South America. And so you took it upon yourself several years ago. You mentioned this in your talk to address some of the poor and underserved Hispanic people here in the Houston area. And you started an organization called Casa El Buen Samaritano. You mentioned it briefly, but could you we have a short video that we want you to watch, the attendees to watch in a minute, but give us just a little bit of the vision behind it.
Well, our pastor came to me one day and said, is there something we could do to meet the needs of poor patients in our community that don't have access to care, particularly the Hispanic population? And I said, have I got a deal for you? I had previously worked at a faith-based clinic in Oklahoma City when I was working there. And I said, yes, we can do this. And so we flew up to Oklahoma City, visited that clinic and a couple of others up there. And he said, I want to do this. So we partnered with Leper Baptist Church, it's a Hispanic church, and just developed a primary care clinic staffed by volunteers from our church, and many other churches now provide volunteers. And the mission of that church is really to provide holistic mind, body, spirit care and share the gospel of Jesus with every patient walking through the door. It's the only free clinic left in the greater Houston area. We serve many, many patients, and it has just been a joy to have a chance to work and practice in that clinic.
And Casa's expanding some.
It is expanding. We have a new facility that we'll be moving into in about a month. And we're beginning to work with churches in the area to develop some additional clinics. And our vision is that we could have a network of faith-based clinics where people receive great physical care, great holistic care, and hear the message of Jesus.
Wow. Dr. Spann, thanks for your time. I think we're going to watch a video here in a minute. Chuck, any questions?
We do. In fact, yeah, we'll get to the video in a second. There's two quick questions that have come in just the last couple of minutes. One of the first, and I thought this was an interesting one myself, in your experience, talk about the kind of reaction that you received from sharing the gospel in Muslim countries.
Well, the country where we lived and worked had a law that said you couldn't openly proselytize.
Right.
So we wouldn't go around, with the Bible in hand, openly proselytizing and sharing the good news. It was very relational. It was very subtle.
Yeah.
And yet we found time and again our Muslim colleagues listening, asking questions. We would be invited to the home of some of our colleagues. I would be asked to pray over dinner. And we had multiple opportunities to just share the way we believe, and sometimes to talk about the way they believe.
Yeah.
It was very relational, and it was a great opportunity.
One more question, then we'll go to the video and see a little bit more of the work. I've been struggling. How do I know when it's time to move to the next task or mission in my life? That's a big question, but
well, that's a great question for someone who's had such a peripatetic career and so many different jobs. But I think God speaks to us in a couple of ways. I think sometimes He makes us uncomfortable, restless, wanting to do something different. Sometimes He closes doors. And then He opens doors and He gives us visions of new opportunities and new opportunities for different kinds of endeavors. So sometimes it's closing doors, sometimes it's opening doors. But I have found that when I pay attention to that and listen, if I understand that it's time to do something different, He always provides a place. Yeah. And all I have to do is trust in Him and walk through that door.
Beautiful.
Keep your heart open, stay pliable,
Absolutely.
Let God do what you can.
So good.
Dr. Spann, it's so good to have you here. Thank you so much for joining us today. We appreciate it.
It's great to be here.
All right, let's take a look at that video and see some of the work that they're doing.
It seems like missions has always been part of my life. I was born into the home of a pastor. My parents, early in my life, felt called to international missions. And so when I was about 6 years old, we moved to Latin America. I spent 10 years growing up in Uruguay, was involved in their mission work there, felt really a call to medicine as a career very early. And I've always viewed medicine as ministry, as a chance to minister to people through the healing of Jesus. So Dr. Barry Landrum and I were at a luncheon several years ago, and he leaned over and said, "Have you ever thought how we might be able to minister to Hispanic people in our city through medicine?" Because we have a number of healthcare professionals in our church. And I immediately said, yes, I know some great models of places that do that. And he said, well, let's do this. And so we began to work together with other folks in our congregation, Royce Hassel, for example. We put together a small committee to begin to think about this. We found a partner congregation in Iglesia Oreb, and they were very interested in partnering with us and in hosting the clinic on their campus. And our church really became enthusiastic and supportive of this. And we very quickly moved toward making Casa Buen Samaritano a reality. The need from a medical standpoint was just to provide care to people who didn't have access to care. Of course, our vision was that this was a medium, a way to not just meet their medical and physical needs and their emotional needs, but their spiritual needs. And that really has been the mission of CASA, to provide holistic care to people in need. And I think that we've been quite successful.